Hey everybody, it's Dr. Wise here from the Wise Institute for Hair Restoration. Today I'm going to do something kind of fun. We're going to talk about a specific case because I feel as though when patients come in, they kind of don't know exactly how to frame, what they need, and they don't really have much perspective. So hopefully today maybe we can shine a little light on a case here, and then in the future I'll present future cases so we can get a sense and see. Not everyone's the same, of course, and no two people are identical, but there are some patterns that exist, and it might be helpful. So this is a let me pop him back. This is a 36-year-old gentleman. Came in approximately a year ago. Very happy with his life. Everything was going well, but he just didn't really love his hair. Particularly, he had some hair loss in what we call the frontotemporal region. The frontotemporal region is basically the front of the hair. The hairline. In addition to that, he also had some thinning progressing a little bit further back. So broadly speaking, in our practice, we call this zones 1 and 2. There's roughly 4 zones of the scalp that we talk about when we talk about hair transplantation. There's 1, 2, 3, and then the vertex of the crown, we call that zone 4. So he was really a zone 1-2 kind of guy, and really didn't like it. Didn't feel like it framed his face, made him look old. Didn't really like the appearance of it. I'll show you this is a side view of the same gentleman. And once again, nothing terrible. I mean, but he thought that this sort of washed him out. He didn't like the way it looked. In the past he had much fuller hair and he wanted a change. So the question is, what does this mean, as far as our graft count? What does this gentleman need? And we had discussed various options with him, but we decided on approximately 3,500 grafts. And 3,500 grafts, remember, a graft is not a hair. So we're not talking about 3,500 hairs. That's only if we did all single grafts. As many of you know, a hair graft consists of 1 hair, 2, sometimes 3, and even occasionally you'll get your 4-hair graft. Clearly, when we reconstruct hairlines, we like to bias in the very front of the scalp. We like to use single hairs because it looks the most natural. But as we get further back, we want more density, so we'd like to take advantage of larger grafts. So when we say 3,500 grafts, in this case, we're probably talking about maybe anywhere between 7,000 to 8,000 hairs are transplanted, but the graft count was approximately 3,500 grafts. So as many of you know, the procedure, you spend the day with us. It's really fairly straightforward. We did an FUE procedure for him, follicular unit extraction. As a lot of you guys know, it means that there's no incision in the back of the head, but we're doing actually small little direct excisions of the follicles. The harvesting in our hands is pretty unique. We're one of the only practices in the entire country that actually use a 0.5 millimeter punch. It's a really, really small punch, which is about the size of a needle. So therefore, guys could wear their hair short. You can even shave the back of your head if you wanted to do something like a skin fade. Obviously, you could wear your hair long and bushy as well. It wouldn't make any difference. But the fact is that the donor, there's very, very little what we call donor morbidity. A lot of times what we see when patients come from overseas or they have their procedure done elsewhere, the punch size is quite a bit bigger, and sometimes they do something called overharvesting where there's too much taken, and you can really see some serious density issues in the back of the head, and it kind of is a tell that's not aesthetically pleasing, so we don't really love that. But anyway, he had a 3,500 graft case. We usually do PRP with the case, which is platelet-rich plasma. We think it helps the grafts take a little better, helps improve healing. So let me show you some really fun before and after. So this is the gentleman, of course, before we saw him, and this is approximately one year later. He had a really fantastic result even at 6 months, but by a year, that's kind of like the final result. So once again, this is before, and this is our very happy patient afterwards. This is after about 3,500 grafts. As you can notice, hairline reconstruction is really a bit of an art form. You have to be really careful about making it look normal so that people don't say, oh man, that guy had a hair transplant. We don't want that. We want to be the best kept secret around. So for that reason, we like to make the hairline irregular. There's certain characteristics of male hairlines that make it look the most natural, and we like to obviously do that for all of our patients. This is another view. This is his 3/4 view here, and you can see this is a year after the procedure. And you can see this guy. There's no one in the world who would see this guy and say, "Oh my God, look at that guy! He had a hair transplant. It looks really natural. It looks like he's always had the hair." And as all of you guys know, this is hair that grows normally. You can obviously go swimming. You don't have to worry about the wind messing your hair up or anything like that. This is really a very, very natural look. So this is an example of an FUE hair transplant in our practice here with some PRP. In addition to that, we also we also do the micro FUE technique, which has been really terrific and have produced some great results. So if there's any questions, anything I can answer for you, please reach out to the office. I'm happy to talk to anybody. Take care.